Hello, I'm John Broom with the Dalhousie Medical Research Foundation. This is part of a series of updates on some of the research taking place at Dalhousie University as it relates to the COVID-19 pandemic. Today we are pleased to present something a little different. Most of our recent videos have featured Dalhousie researchers who are focusing their efforts on the COVID-19 pandemic. This time, we're connecting with a member of the DMRF Board of Directors who looks at COVID-19 through a different lens. Direct from Geneva, Switzerland, we welcome Dr. Kate O'Brien, the Director of the World Health Organization's Department of Immunization, Vaccines, and Biologicals. Dr. O'Brien, when you look at COVID-19 globally, how does the situation in Canada compare? What would you say Canadians have done well when it comes to managing this pandemic, and how can we do better going forward?
I think in Canada there are a number of things that really stand out with how the country has managed this pandemic. The first, I think that's most important, is the really transparent and frequent communication by leaders in Canada, both political leaders, economic leaders, and most importantly, the public health leaders. I think the second thing is that Canada's response has really been data-driven, has really been driven by the science, has been driven by the evidence about what's really happening. And I think the third thing is really around communities and local adaptation. I've really seen that in Canada, there's a very clear understanding that no solutions here are based on individuals. It's really based on the collective and people making decisions to do what's best for the whole of the community, the whole of the province, the whole of the country, and really understanding why that is needed.
In a world that is increasingly connected, protecting global health is increasingly complex. What role do health researchers play in this process, and why is their work so important?
The work of researchers in addressing both this pandemic and the global health issues is that we can't make progress on any of these public health issues without new knowledge. These are novel pathogens, they're novel problems. And what researchers really provide to the ecosystem of addressing these problems is the evidence on which we can make sound decisions. Research really informs the biology of these diseases. It informs the strategies that we should use to control them. It informs the innovations around treatments, diagnostics, vaccines. And without the new knowledge that researchers create, we're really flying blind in terms of what to do and the availability of the interventions to actually control and eventually really squelch what's going on right now.
It's been widely reported that we may experience multiple waves of COVID-19. What might this look like, and why will health research still be critical as we go forward, even after we find a vaccine?
Nobody really knows exactly how the COVID pandemic is going to continue to evolve, whether we'll have multiple waves happening, whether it will become a seasonal pathogen, whether we'll actually have big outbreaks that occur sporadically around the world. And so because of that, because we're frankly still in the early stages of this new pathogen and its impact on us from a health perspective, a social and an economic perspective, we have to be prepared for any eventuality. Some of the key eventualities are whether we're going to have these second waves, third waves, fourth waves. And so the research involved is critical in both modeling what could happen and the interventions. And I'd like to really focus on the vaccines. We certainly hope that we'll have a vaccine very soon, but it's not likely that one vaccine is going to address all of the questions that we have and all of the needs that we have to address the pandemic. And that's why research is going to continue to be important. We're going to need multiple generations of vaccines, probably of different types, so that they can address each of the groups of people who need to be immunized. Those who are older adults, perhaps younger adults, women of childbearing age. Not every vaccine is going to be suitable for every part of our community.
When an eventual vaccine becomes available, what can be done to ensure that it's available in all countries?
So this COVID pandemic is a worldwide problem. It's involving nearly every country in the world, and that means that the solutions that we have to this and the interventions we have got to be available with fairness and equity to every country in the world, every family, every community in the world. There's a huge amount of work going on as we speak to assure that that will happen, that in fact that vaccines will be delivered to those most in need, those who are at highest risk of serious outcomes, and for those people who are really protecting our communities, healthcare workers and essential workers, both for our social benefit and our economic benefit. And distributing those vaccines in a fair and equitable way so that those who most need them get them first is really a critical part of controlling the pandemic. We know that this germ does not recognize borders. It doesn't carry a passport. It doesn't care whether or not it's in one country or another country, and neither should the vaccine.
How might the work we're doing now with COVID-19 help us deal with other emerging public health threats in the future?
The work we're doing right now with COVID-19 really has other payoffs for future threats. For instance, what we're seeing in the work that we're doing now is that there is this incredible cooperation between scientists around the world to go as fast as possible to address the evidence that we need to control the pandemic. We're also seeing that there is this incredible scientific literacy among communities. I don't think I ever imagined that people would be talking about epidemic curves or flattening the curve in the way that we hear people talking about it, and really understanding what the value of vaccines are and the value of public health is, that our individual health is very, very much tied to the health of our communities and the health of other countries around the world, that we are very interconnected, and there's no changing that. And so anything that we can do to assure that everybody around the world has protection and has access to those interventions that will really make a difference to protect ourselves from serious outcomes is of benefit to ourselves as well as to other people.
Thank you, Dr. O'Brien, for the work you and your colleagues at the World Health Organization are doing to combat COVID-19 and for sharing your insight with us.
I'm so pleased to have a chance to talk with you, and I really appreciate the work of the DMRF and the opportunity to work with you.
If you'd like to find out more about the COVID-19 research DMRF donors are helping to support, please visit dmrf.ca/coronavirus. And if you have any questions or concerns you'd like to share, or if you'd like to help, we'd love to hear from you at dmrf@dal.ca. Thanks for watching.